Let's start the video with a story about a prodigy, a girl who could have touched the moon but was buried under the piles of money, a victim of her government's failure and our lack of sympathy. Her name is Thuivi. Thuivi is a brilliant student. In her last exams, she proved her brilliance again, and the results were out a few days ago, and we all got to see it. As always, she did an impressive job. She scored 92 out of 100 in the first language, 92 out of 100 in the second language, 97 in maths, 97 in physics, and 95 in the life science. This is a top tier performance which puts her in the top 1% of these students. With this kind of dedication and hard work, she could have been anything. But the tragedy is that we will never see her in her true potential. She is not with us anymore. She is dead. So what happened is that just a few days ago before the exams, she developed a liver condition. Despite her illness, she gave all of her exams and did the best she could have done. But things did not go well. Very soon, her situation got much worse. So, after multiple tests, doctors said that she has a severe liver condition and if not treated soon, it might kill her. But the cost of treatment was very high. It was almost a crore, which is roughly 150,000 US dollars. For a family like her, it was impossible to arrange such an amount of money, but they did not give up. Her family, friends, and local residents donated as much as they could and tried to raise money. But all that effort was not enough. They only managed to arrange 45 lakhs, which was not even half of the required money. But time was running out. She was in immense pain and needed treatment immediately. But the world did not have enough mercy on her. On 16th April, so we passed away. Now you may wonder why I am telling you her story. This video is about poor healthcare system, not someone dying. Well, you may understand the point, you may not. Let me explain anyways. You see, her death was not an accident. We knew she was sick and needed treatment. We knew that a lot of money was required, but we could not arrange them. It's not like her family or friends did not try enough to save her. They did. It's not like the doctors were not willing to save her. They were. But all that effort, all that money was not enough. Now this brings us to a question. What if it was me? What if it was any of my loved ones? What if they died not because I did not try to save them, but because healthcare is not a right, it's a privilege? Just imagine how frustrated and angry you would be to lose someone over money. Even though money is everywhere, it's just not in your hand. What an unfair game when money decides whether you live or you don't. This is just another side of modern capitalism. But let's not talk about that. That's not the topic of our video. Now you may argue that for some diseases, healthcare is expensive, the medicines are expensive, and treatment is hard to get. Yes, you're right. Some treatments are hard to get and medicines are expensive. But isn't it concerning that my life has a price tag and if I can pay that, I die? You see, in our country, the population is so high that it itself can create thousands of extra problems, and the lack of doctors is one of them. Even though every year almost 70 to 80,000 students become doctors, the lack of doctor issue is still there. There are only one doctor for every 11,000 patients. Just imagine if you had a fever and you had to stand a line behind thousands of people, you would be dead. But if you wanted immediate treatment bypassing all that line, then you have to go private. But if you stay still and somehow manage to pass all the lines and secure a bed for you, you might regret it. You see, our hospitals are as bad as a world prison. The construction was done during the 90s. The walls are falling apart. There are rats all over the floors, and the ceiling looks like it wants to give you a kiss, a deadly kiss. Not only that, you share oxygen cylinder with your neighbor patient, you're given garbage to eat, and there's aroma coming from the drain just behind the wall every day. Still, if you somehow manage to survive all this, this will be a great feat, and you will be aura-farming your entire life with this story. But it's just a probability. You're most likely not going to survive this hell. You see, every year over 1.6 million people die due to poor quality of care. This number is more than people dying of cancer or any other disease. The number 1.6 million doesn't strike quite much, does it? We really don't understand what 1.6 million deaths is like. Imagine your wife, husband, or anybody you love dies. Now imagine that happening 1.6 million times to 1.6 million families. That's the scale. I really can't comprehend what that is like. The frustration, the sadness, the regrets, insane. That's not the end. Our hospitals not only lack doctors, hygiene, food and medicine, but also a vehicle to carry your dead body in case you die. You might have seen a reel where a brother is having to carry her dead body's sister in a bike because there is no ambulance. You can literally see him crying, shivering, unable to speak. Can you imagine how that might have felt like? Can you imagine to be him? Can you imagine how it feels to have to carry your sister's dead body when you are mentally dying as well? That's painful. You see, the celebrities, the influencers, the media, they will not show you this side of our country. They want you to stay blind. This was just the government sector. The private sector is not any better as well. It's like a double-edged sword. If you are poor, then you would not even be able to register yourself there. And if you are from a middle class family, then you will have to borrow money, take loans, and even beg if necessary. But all that money will not do anything better. The moment you run out of money, they will throw you out. It's very poetic that you either die at the front door or they let you live long enough to pay off all the debts. This hypocrisy isn't just here. You take a globe and point it anywhere and you'll find the same system. For example, let's say the US. The USA, United States of America. The first things that come in our mind are Donald Trump, fighter jets, dollars, white people, and the 9/11. Another thing that comes in my mind is the fat people. In the USA, the people are not the only thing that is fat. The healthcare bill is even fatter. The healthcare in the USA is so expensive that people would rather die than get treated because they know medical debt is the main reason people go bankrupt there. So they choose to die at once instead of dying every day for the rest of their life. For your better understanding, let me share a little data with you. The main health expenses in the USA are divided in a few categories, and these are hospital care. This is the largest expense. Almost 30% of the national health expense happen here. It includes different services, surgeries, and emergency care. And the main diseases are cancer, diabetes, etc. Then, physician clinic services, which is 20% of total national health expenses. And these issues are mostly hypertension, mental health, and infection. Besides these major health expenses, there are many other ways they drain out your pocket. For example, an ambulance ride could cost up to $5,000 and a broken bone $20,000. Insane, right? Now it all makes sense why people make meme about the USA healthcare expenses. To summarize it all in one sentence, it's like best technology versus access. The disease is in the system. The healthcare is a business. Let me tell you a story. The other day I was watching reel. Then I saw a reel about the shark tanks. So a woman came with her idea of DNA testing of cats that could cost up to $30. So one of these sharks argues that why would anyone spend $30 in this if they can get a new cat for just $5? See the point? He did not care for the life. He cared for the money, for the profit. He indirectly said, why save my dying daughter if I can give birth to another one? He did not care for the emotion, for the relation, or the value of life. And the tragedy is that our hospitals, the healthcare organizations, are run by people like this. So you can guess what we are to them. Nothing but objects. Hospitals profit more from chronic illness than curing people. Pharmaceutical companies price life saving drugs for profit, not people. Cancer dialysis, ICU, the bigger your pain, the fatter their check. They don't want you dead. Dead people don't pay bills. They want you sick enough to stay, but weak enough to keep paying. Indeed, the money hungry companies are here for profit, for not serving people. But what the government is doing? Did we not select them to give us better service? The reason they don't care is simple because there is no pressure on them. They know what is important and what is not. If you want to win votes, talk about religion, caste, not about hospital beds. Build mosques, not hospitals, because these are more important than people dying. People can be given birth again, but religion, no, it can't be. It's more important. The people that are dying can always go to heaven, but religion is just once in a lifetime. You would be shocked to know that only 1.3% of our GDP is for healthcare, but according to WHO, it should be at least 5 or 6%. Even amidst the 1.3%, it is full of loopholes and corruption. Right now, some very honored yet corrupted MLAs are buying their fourth Fortuner with the money which was sent for the development of the local hospital. But it doesn't matter. The media doesn't care. They are busy covering celebrities because they know what is more important. Those dramas are more important than people dying. They don't care for us. But we have to do something because we want a better tomorrow, a better future for the next generation. Because we want to survive. So the first thing we need to do is spread awareness because unless people know about this blunder, they can't take any action. So share this video as much as you can with your family and friends. Secondly, the second thing you should do is educate yourself more because the more you know, the better you can share, and more importantly, you can be incorruptible. We have to understand that healthcare is a basic human right. Doesn't matter your religion or caste, we all deserve to get treated. We need a revolution on how we treat the sick. The world doesn't need more medicine, it needs more sympathy. Thank you for watching. And by the way, if I have made any mistake or missed any point or you have any suggestions, please let me know in the comments. I'm still learning and growing.